Hi everyone. So today what we're going to do is we're going to talk about what things look like underneath your prosthetics over time. This is typically what we expect whenever we take the prosthetics off, whether it's, to sign you off after 8 to 12 weeks, or whether it's 5 years, 10 years later on. If you actually look at the quality of the gum health, and if you actually ask someone like a periodontist who is a specialist in gum health, they will tell you that gum health is beyond excellent. In fact, in here, one of the things we talk about as the surgeons is we talk about resetting somebody's gum health to as good as it was when they were 4 years old. And that's as good as it was when they were 4 years old. It's that healthy. So this paranoia about not cleaning it properly, well, look at it. It's been self-maintaining for the longest amount of time. This is the lower jaw, that's the tongue, there's the lip, and this is what we expect to see. Can you see how pale pink all of this is? Pale pink is super healthy. Why is it ever so slightly red round here? That's because that is the biological interface, but these are single-bodied implants, which means there are no connections below bone level. What does this mean? What this means is it's all up here at the top, and it's all being maintained by your body. Now, this is almost exactly the same thing that we see on everybody's natural teeth if we take them out. So even if we're not taking them out for gum disease, but it's just tooth decay, when we take it out, we see this red interface, because that is what we call the transmucosal connection. It is the connection from the outside of the body to the inside of the body, and that's where the bacteria want to have a bit of a fight. But here's the good news. The good news is your body's health is good enough to keep it only here and nowhere else. And everywhere else between the implants, perfectly healthy. Even though you can't take them off and rinse them under the tap, but you can't take your own teeth out and rinse them under the tap, and nobody seems to be paranoid about that. So you really shouldn't be paranoid about this. We understand the anxiety, but you have to understand the science behind it means you shouldn't be anxious. Your anxiety is irrational. These are the scientific realities. This is what the upper jaw will look like. Again, this is immediately after removing it for the first time post-surgery. This is incredible healing, because we'd actually opened all the gum up to access all the disease and removed it all, and it didn't look like this the day we were removing all the rubbish. But look at it. This is actually just 3 weeks later. It's not even 12 weeks later, it's 3 weeks later. How good is that for 3 weeks later? It's incredible. And what do we actually do sometimes? We actually take the prosthetics off and we test them. So this is a video. So my colleague is tapping on the heads because we are listening for implant resonance. And if it sounds hollow, what it means is it and the bone have got an intimate connection. That's what we want. This is what we want. This is the very osseointegration that we're trying to achieve. And it's not a static process. It's not like a nail in a block of wood. It's a dynamic process because the bone is remodeling all the time. Remember, your implants are not the things that are doing the magic. The thing that's doing the magic is your jawbone and your gum health and your saliva. See how it's all glossy and shiny? That's because there's 24/7 saliva going around it all the time. You're never going to keep up with your saliva with your 2 minutes in the morning and 2 minutes in the evening. And if I'm really blunt, the main reason I want you all to brush is so you can psychologically feel that you still have teeth. You don't. What you have are prosthetics, which will require a completely different set of rules for maintenance compared to teeth. So a prosthesis cannot suffer with tooth decay because they're not teeth. That's how you know it's not a tooth, because you can shove a Mars bar on it and leave it there for months, for years, and you're never going to need a filling, ever. So it's really the psychology behind it. It's really important for patients to feel like they're contributing, they're doing something. But trust me when I tell you, we engineer it so that even if you didn't, it's still incredibly robust. If you got deserted on a stranded island and your luggage didn't come with you, and there's no Sonicare, there's no toothpaste shop, there's no place to buy Blue M, One of the last things to fall to bits will be the implant prosthetic setup in your mouth. So please don't worry about it, because as you can see, this is pretty much everybody we see post-surgery. This is pretty much how they all look like. That's how predictable this science is when deployed properly. Thank you very much.